we're sitting here 5 years from now, and thanks to your company, what are you looking back in 2024, amazed that from a healthcare perspective, women were X. What's changed, and what role has your company had in creating that change?
I'm general manager in the US for Aspivix. So Aspivix is focused on making gynecology modern, and we are tackling pain and reduction of bleeding, especially for any transcervical procedures in gynecology. The most common one is the IUD insertion. So we are still using 100-year-old instrument that was developed during the US Civil War that was used to extract bullets from soldiers. And now we are still using it on women every day to insert IUD. So basically, this is this awful instrument that looks like very Sharpie, and that needs to go away. We know that a lot of women, we probably know personally or even around you, any woman who had experience getting an IUD was painful and even traumatic. 120 million women are just suffering from that pain. So where we see ourselves 5 years from now, we hope that our device, which is suction-based, instead of pinching the cervix, which is way more gentle, it reduces pain by 73% and bleeding occurrence by 83%. We hope that this becomes a standard of care in gynecology. So that's what we are tackling right now. We have 810 patients over the last 8 months that have benefited from it, 99% of patient satisfaction, and women around the world, in Europe, in the US, and also now in Brazil. Great experience also from the provider, and that's what we are really making. It's all about making gynecology modern. So let's get rid of the old traumatic instruments, and let's get into more empathic and safe care for women.
Based on what you're doing today, if you could share one real outcome, short story or use case that is happening today and positively affecting the women that are using your product.
And one story that really touched my heart, and it was around Christmas time last year. I had one woman who reached out to me out of nowhere, and she basically just wanted to say thank you. I was like, okay, let's have a chat. So we had a conversation. She's 29 years old. She lives in Philadelphia, and she called me because she wanted to share her experience getting an IUD at 24 years old, and that experience was horrible, traumatic. She basically went to get an IUD. She ended up with a huge pain that make her not able to go to work for 3 days. And that experience, never again. So when she had to renew the IUD in 2023, basically she went into depression, anxiety at the top level. And she's like, I'm not going to do it. It's 2023. It must be something out there. And she basically started doing some research. I was like, even if I think that's probably something out there, I'm not giving it a try. So she went to her gynecologist and tried to see if there's any other options. Basically, her gynecologist was like, you should probably choose abstinence at this point. So we're still in that age where you still not only gaslighted, when you talk about pain, you're not believed, and you are just judged. So that's on top of everything else. So she moved to a different state, and they gave her birth control pill. It didn't work for her. After 3 weeks, she ended up getting blood clots, and she ended up in the ED. So she only had one option, going back to the IUD. So she did some research, and she found our device, and we just got FDA clearance at that time. And basically, she asked us, where do I find an OB-GYN using it? And that's where we redirected her to Columbia University, which was our very first site in the US. So she made an appointment, she went there, and she had a great experience on both sides. It was really patient-focused experience. Not only the device worked on her, it really reduced pain, but on top of that, the clinician was also very understanding, very gentle. So it's a combination of all of that. And the experience went way better. And now we have 800 patients who have benefited from it.
Well, what I'm going to ask you to do, because I think so much of success is around your team and your company and the humans involved in your company, and you folks are the leaders. So I want you to come up with just 3 words that define your team, what keeps people excited, how you're being sure that you get inclusion of different voices, and given the time, literally 3 words or 3 phrases that best describe what differentiates the humans in your company.
I would say passionate, very diverse team who care about patients.